Good Saturday morning to you, everybody, and welcome to HyperFit MD Radio Show. I'm Gary Byron, joined as always by Dr. Charles Guglin, as well as Francesca Guglin. Good morning, folks.
Morning.
How are you?
Good.
How's your week? How's everything going?
We had a good week. Slow, kind of post first of the year doldrums. But we
Doldrums?
Well, you know what it is. People
Time of year?
Yeah, time of year, that kind of thing.
Yeah.
People are all excited for the holidays and stuff like that, and then they go into their cocoons after the first of the year.
I'm sorry, I don't mean to interrupt you, but pertaining to that, you're like the third person in 7 days in a week that has told me that they've got the winter blues, and that they've even used the word hibernating, and that psychologically the spring and the summer and even the fall is great, but in winter there's depression and sad. They look at things with a lot of melancholy. So is there, because I heard it from three different people in the course of 1 week, I kind of think, well, there must be some truth in that. But let me ask, I know you're not a psychiatrist, but is there some truth in that?
Absolutely.
Really?
Yeah, they talk about seasonal affective disorder, and I think that I never talk politics, but all the politics and stuff that's been going on in the last year, everything seems to have come to a low ebb for a while. People are hibernating. We live in a condo complex that's right by the water. And in the summertime, it's very, very active. But like this time of year, you would think that we live in a ghost town. People just go in and they don't come out.
You're in Milford, right?
Yeah, we're in Milford. Yeah.
Wow.
And we had our first vaccine on Friday.
A vaccine for the coronavirus?
The coronavirus, yeah.
Wow. All right. So, boy, I'd love to hear about this.
Oh, it was a trip. We had the disease back in March, and we had it really bad. We had to close our office for about 4 weeks because we were really sick for a couple of weeks anyway. And the vaccine, we have a lot of antibodies. From an objective standpoint, we know we have a lot of antibodies, and it was like they were waiting in ambush for this vaccine because, man, it hit us hard. I had fevers the next day, like 4 a.m. after the vaccine. I woke up with a temperature of 100, and I was shaking chills and stuff like that. And then we both had myalgias and joint pain for a couple of days. We basically went to bed for 2 days. It was a trip.
Is that a normal reaction to getting the vaccination? And you said this is the first shot, right? Because it's a two. Yeah. Is it the Moderna or is it the Pfizer?
The Moderna. Yeah.
All right, so this was after the first shot.
Yeah, I think it's normal.
Because we had the disease. That's because we had the disease.
So you had the coronavirus back in the spring, though, right?
Yeah, I think if someone hasn't had the disease, the first shot is not so bad. Yeah. It's because our immune system has already fought the disease in the past. So that's why they say the second shot for people who haven't had the disease is a little bit harder because now their immune system has already had a taste of the virus, the first shot.
They're starting to make antibodies.
Yeah.
You asked, is it normal? It's normal to have a reaction, but the reaction is extremely variable from person to person. We have a lot of friends who are obviously in the healthcare field, and many of them just got a little bit of a sore. Yeah. Most of them just got a little bit of a sore arm, for a couple of days.
Right. That I've heard. Yeah. I've only heard of one person who actually called the morning show last week and mentioned what the symptom was. He goes, his father, I think he said he was. My father got it. He's 70-something years old. He got the shot, and he was ill. And then I think he referenced Hank Aaron, who passed away last week. Uh-huh. And granted, he was 82 or 83 years old, but really didn't have any symptoms. He just he was trying to show his fellow African Americans that, I'm going to go in there and I'm going to get the shot. And he ended up dying in his sleep. So now I know age plays into this majorly. Yeah. I don't want to deter anybody from getting the shot, but it's good to know that if you've already contracted the coronavirus, by what you're saying, be prepared for some
I think if you have
side effects.
If you have antibodies work. That's I think if you get that shot and you have zero reaction, and this is just a guess really, that probably your immune system is not really responding to the virus, to the vaccine.
Or to maybe to the virus even?
Yeah, I mean I think because we have boatloads of antibodies from having been really sick with this thing, I think that's why we had such a response to the vaccine itself. And I don't think people can anticipate going through what we went through. I think vast majority of people have a little bit of a sore arm, just like they do with the flu shot,
Right.
just like they do with the shingles vaccine, all these other vaccines.
You've had that too, right?
Oh, yeah.
That's a double. Isn't that a double vaccine?
Yeah,
The shingles
yeah,
one?
it's like 4 weeks apart. So,
Are you guys nervous about a month from now when you
Yes.
get the second?
yeah. We're doing it on a
Dreading it.
Friday. We're taking the weekend off.
Not looking forward to it.
Oh my goodness. Well, then let's just prepare yourself, I guess. But the doctor has got to educate you, right? The doctor's got to say, or unless he already knows you're a doctor and he just figures, well, you already know this stuff.
They
Like,
don't educate you because they don't really know.
they can't say, all right, no, be prepared that you may end up having some symptoms, and they don't say.
Exactly.
They don't say that.
Well, you also get, if you sign up through the state to get your vaccine like we did, you get a series of texts for the 4 or 5 days afterwards asking you questions about your symptoms. They're obviously gathering data on this because
Yeah.
there's a whole questionnaire that you fill out from day to day about your symptoms, whether or not you had fevers, whether or not you had myalgia, stuff like that, which I think is great because they're obviously collecting data.
So you're like in a doctor. Are you at a CVS or are you at a doctor's office?
We went to Parsons Complex in Milford, which is the town hall.
It's organized by the Milford Health Department.
Okay.
Yeah.
And you had to fill out forms before they'd even.
We did it online. Yeah, you make an appointment online. Yeah,
And you filled out the form online so that when you get there, you're strictly just getting the virus, getting in
Correct.
and getting out. Okay,
Exactly,
I
yeah,
got you.
yeah. It's called the VAMS, Victor Alpha Mary S.
Sam.
Sam.
I want to talk to you guys after you've had your second, not immediately after you've had your second vaccination, but I'd be curious to know what ends up.
We'll be here.
Well,
One way or
because
the other.
you must have heard it like I have. That's supposed to be worse then. So
Yeah. Well, we'll see.
okay,
We'll see. Maybe we'll get lucky.
I hope so. My heart's with you guys. You know what I wanted to talk about this morning was composition analysis. What is composition? Body composition analysis. Let's put it that way.
Yeah, it's one of the key components of the workup that we do on patients, and one of the key components of how we follow their progress in the practice. Body comp is simply, it's intuitive what it is. Basically, we're able to, because of the technology we have in our practice, we can tell you, let me just go through it. We have a DEXA scanner in our practice. We do VO2 max studies in our practice. We do resting metabolic rate studies, and we do boatloads of blood work, lots and lots of functional blood work analysis. And in total, in aggregate, once you have all that data, you can sit down with somebody, and that process takes 2 or 3 hours, really. It kills a morning. In aggregate, you sit down with somebody with all that data, and you can tell them from a health standpoint and from a metabolic standpoint exactly where they are that day, basically. Yeah. And it gives them an enormous baseline. A lot of people walk out of our office after that day having learned a lot more about themselves than they ever wanted to know.
I'll bet.
Yeah, I mean, we kind of drift through life lying to ourselves about our state of health. And I think one of the most motivating factors that gets people to a level of compliance in our practice is learning what they learn those first few days that they come by. And body composition is part of it. Body composition basically, that's a really long answer to your question. Body composition basically is telling you within only a couple of percentage margin of error, your body fat composition, your lean body mass, bone mineral density. Go ahead.
No. I'm taking this all in, but I guess it's probably essential to your practice. This is why, you would offer.
It drives compliance.
Something like
is
this.
what it does. It drives compliance.
What are the different components, let's say, of a body composition?
Well, let's talk about DEXA scanning first. DEXA scanning is pretty much everybody comes through the practice is scanned DEXA scan was virtually every hospital has a DEXA scanner because they use them to do bone mineral density analysis.
Well, okay. I never heard of one. Oh,
osteopenia, osteoporosis.
Okay.
Trust me, every perimenopausal it's interesting. They market these to women because there's a pill for it, and so you hear about it on TV a lot. But men get osteoporosis just like women do, and it's important to know that aspect. But also, the one that we have tells us within 2% margin of error is literally the gold standard. What your body fat percentage is, your lean body mass, which is all the muscles and the hard, the solid organs, liver, spleen, stuff like that. And it breaks up the fat in your body into two separate categories. One that's called gynoid fat, which is that kind of outside fat. It's the fat that makes your pants not fit. It's the fat that we all hate.
Yeah.
And then there's visceral fat, which is the inside belly fat, that fat that's inside your abdomen that encases our organs. This fat is completely different because it's metabolically active. And it's one of the principal causes of metabolic syndrome, which includes insulin resistance, hypertension, plaque formation, cardiac disease. What physicians call the metabolic syndrome is driven to a large degree by that belly fat. And we want to know, and what it tells us is ounce for ounce in a cubic inches, how much belly fat that you have. And it breaks it up into categories in terms of your cardiovascular risk. And what we want to see in our practice is we want to see that belly fat melt away.
So that's what you learn from a DEXA.
Right.
Is cardiovascular risk.
Right.
And then you can adjust your treatment plan around that then, right?
Sure.
Because we all have different risk for going into cardiac arrest.
Oh, absolutely. Yeah.
We were talking a little while ago where it's interesting that we can take an overweight let's take a look at two people, same sex, same age. Let's look at two men who are, 50, 55. One is morbidly obese. And the other one is, average, You would think that the person who's morbidly obese is probably more prone to going into cardiac arrest and having a heart attack. Mm-hmm. But that's not necessarily the case, right?
No
you can actually have somebody who looks pretty physically fit and maybe even goes to the gym on a regular basis, is very cognizant of the foods that he puts in his body, and yet that person, look at who's that guy? Was that the Scarborough diet? Scarsdale diet, right? Okay.
Scarborough.
The Scarsdale diet, right? Wasn't he he was jogging one day in New York City and keeled over on the sidewalk and dropped dead of a heart attack?
His heart vapor locked on him. Yeah.
And he was otherwise a healthy guy.
Right.
How does?
Well, I think we associate thinness with health in this country, which is just it's a bad I'm trying to think of the word. It's just a bad indicator. It's not a false indicator of health. Lots of thin people have metabolic issues that they've inherited. They're lucky enough to be thin, but by the same token, they live a lifestyle that puts them at risk. Stress plays a huge role in our health over time, and people who are stressed to the max and don't know how to handle that stress wind up being unhealthy down the road. We see plenty of people who are carrying too much body fat who, from a cardiovascular standpoint, if you look at them metabolically, are not in too bad shape. We have people who, and I hate to use Francesca. Francesca's an exact example because she's from the Mediterranean. She's from Malta. She carries some genetically determined issues. She eats super, super clean, and yet she has a triglyceride problem. Her parents do too, and they both lived well into their 90s. So there's a lot of things that work counter to what we know about health and about how to measure health in a person, because a lot of times genetics play a role that we can't measure. Although we're getting better and better at measuring it from a genetic standpoint.
But my parents ate a Mediterranean diet all their lives.
Along with pork rinds and
My mother's 96 and hanging in there.
So diet, and genetics play a factor into one's health. Then it's
sure.
safe
I
to
think
say.
that's intuitive. I think we all know that. Yeah, but by the same token, there's a nature and nurture aspect to it. We tend to eat like our parents ate, like our parents fed us. You know what I mean?
Yeah, you had said something, though, that I think a lot of our listeners would be able to identify with, and that is stress. When you hear, I mean, there's so many people under a lot of stress right now because of what's happening politically in our climate, what's happening in the world. You see a lot of protests going on. You see a lot of civil unrest and injustices, and you see people out of work and how the coronavirus, it limits your mobility as far as going out and taking in all of life's fun activities, life as we were accustomed to, and hopefully we will be able to get back to that
Absolutely.
sooner rather than later, but at a safe pace. But nonetheless, it creates stress.
Yes. Everybody's life has changed. Every single person on the planet, except for people who live out completely remotely, has completely changed in the last year.
So from a naturopath, from an MD, for everything that makes up your experience and that I have extensive knowledge on,
Yeah.
as I learned about you, what can you tell that person? How do you fight through the stresses, the mental stresses, and then that lead to, as you were just mentioning, that lead to poor diet or not taking care of yourself? How do you not let the stresses that you just alluded to get the better of you?
I think part of it is stepping outside your life to a certain degree and understanding the stressors and trying to eliminate many of the stressors. For instance, go ahead. if there are people in your life that are a particular source of stress and you spend too much time with those people, you can eliminate those people from your life. A lot of it has to do with that part of it, but also a lot of it has to do with learning how to handle stress, how to deal with stress. You know, a fighter pilot and the person who folds clothes at Target, both of them find their lives equally as stressful. The key is how you handle that stress. And the problem, the American way, is to internalize it. The American way is to power through. And it always winds up in some somatic problem, either cortisol secretion to the point where you're gaining weight all the time, what naturopaths call adrenal fatigue. The allopathic community doesn't believe in adrenal fatigue. Cardiac disease, it runs the gamut.
Drugs?
Absolutely. Well, how many people abuse alcohol, weed,
Food.
whatever, food? Yes,
Yeah,
yes,
no, true.
food.
Yeah.
Absolutely, food as a de-stressor. When in fact there's probably better ways to handle it. The food aspect, absolutely, is a lot of people eat.
But then
under stress.
that could theoretically lead to addiction in alcohol, addiction to weed, as you just mentioned, or as you alluded to, Francesca, addiction to food, a food addiction. So I guess, how do you internalize mentally that you shouldn't be doing that? We all know we shouldn't be eating a bag of Doritos or a half a gallon of ice cream or Ben and Jerry's at 10 o'clock at night before you go to bed, but yet people still do it. So and they justify it by saying, well, all of these stressors, are getting to me. I'm feeling the weight of the world, and there's so much going on right now, and this is how I cope. But even though they know they shouldn't, what's the answer there?
Exercise.
Which is the best antidepressant on the planet. Yeah.
Yoga,
I think part
Gym.
of it, though,
Meditation.
right? Yeah.
I think part of it, and I agree with Francesca 100%, but part of it is mentoring people to a point where they understand what it feels like to change the way they eat, to change the way they move, so on and so forth. I mean, if you can mentor somebody to a point where they're just compliant, they say 21 days creates a habit. I don't know if that's true or not because I've never really tried it. But by the same token, if you can mentor somebody to the point where they've been compliant for long enough to understand what it feels to live that way, you can get them over that hump.
Folks, you are listening to the Hyperfit MD radio show. Dr. Charles Guglin and Francesca Guglin with us. I'm Gary Byron. What is resting, RMR, resting metabolic rate, and what can we learn from it?
Resting metabolic rate is the number of calories that you burn at rest. So sitting in that chair, your lungs consume a lot of energy, your brain consumes a lot of calories, your heart consumes a lot of calories. Your resting metabolic rate is a benchmark for when you're in fat loss mode. We never talk about weight loss in our practice. If you're in fat loss mode, you want to know one of the key numbers that it's good to know is what your resting metabolic rate is. So let's say your resting metabolic rate is 2,000 calories a day and you want to lose fat. If you can maintain and a lot of people, you can maintain a diet that is 1,800 calories a day. As long as you're eating the right foods, you can very slowly drop weight, which is very, very much the best way to do it. But by the same token, let's say your resting metabolic rate is 2,000 calories a day, and we get you on a high-intensity interval training program where you are jacking your heart past its anaerobic threshold several times during a 30-minute workout. You can increase that resting metabolic rate in a steady way to 2,500, 3,000 calories, so that you're burning fat all day and maintaining. You have to walk the walk from a dietary standpoint. Okay, this doesn't just happen. But if you can get that resting metabolic rate up there through anaerobic training, many of the things that we hear about, Orange Theory, what's that other one? It'll come to me.
Okay.
CrossFit, Orange Theory,
yeah, sure.
all these other ones are based on that concept of high-intensity interval training. So it's just a good baseline to know for any aspect of trying to achieve health and especially losing fat and stuff like that. It's a good thing to know. And we do it in the practice.
You do?
Yeah.
Good. How about VO2 max?
That's a good one. We see
What can I learn from it?
VO2 max tells us a lot. You've seen images of athletes running on a treadmill with a mask on their face and like cardiac monitors and stuff like that. They're having a VO2 max study done. And basically what it is, it's a protocol. It takes about 8 minutes. It's like a stress test, only we're getting different information. Basically, you get on a treadmill or on a bike, and we get you going slowly. And the whole idea is to get your heart rate up past the anaerobic threshold. That's the threshold at which your body's working anaerobically versus aerobically. When you start to feel that burn, okay?
That's anaerobically.
That's anaerobically. When you start to feel that burn,
Yep.
you want to know what that heart rate is, because that's how you introduce and get into a high-intensity interval training program. But it also tells us your lung function under stress. It tells us your cardiac output under stress. It basically gives us an overall picture of your overall cardiovascular health. And again, compares you to 100,000 white dudes your age to tell us where you stand in that population of athletes, if you will. Now, the problem with it is that we can't do it right now because of COVID, because you have a mask on your face, you're breathing into a machine, and we can't obviously do it in a serial way because the equipment costs a lot of money and you can't just throw it away every time somebody comes in. So we're kind of limited from doing VO2 max studies right now
Just for a little bit.
until we get herd immunity and we can be a little bit more confident about people's status.
You talk about how the limitations that we have right now due to COVID, but you're still operating out of your office. It's in Milford, right?
Yeah.
It's by appointment.
Yes.
Sure. Yeah.
You get. What do you think? And forgive me if I've asked this in the past. When people contact you? And I understand there's a myriad of reasons why somebody might, but there's got to be the number one reason that the majority of your clientele contact you.
What do you think?
They're obviously looking to make a change. They're looking
Right.
for health.
Right.
I get that aspect of it, but
I'd say that probably the leading complaints that I hear are I'm getting fat, I'm tired all the time, I'm having difficulty sleeping, my sex life sucks. In general, those are the kind of four. Right?
mid-50s to mid-60s?
Yeah, well, it starts in the 40s with some
Oh.
people. Yeah, I think part of it has to do with a systemic cultural depression that we're all going through. People, this thing that we were talking about before, you have to understand that people our age, the world has changed twice in the last 20 years. Okay, first there was 9/11. Remember when you could get on an airplane and just fly? Remember those days?
Oh, yeah.
And that's just a small thing. Right now, it's become a small thing because now the world has changed again. Every aspect of your life has changed in the last year. You don't notice it, but it's hugely stressful on a very large scale. And I think that people are sort of globally feeling under the weather. A lot of it has to do, like you said, the age group that we're talking about, andropausal men and menopausal women. Everything in your body changes over a period of time between your 40s and your mid-50s. And so a lot of those people are in that category. and they're wondering why, because look, they're going to the gym 3 times a week. They're trying to eat cleanly, so on and so forth, and they're just getting nowhere. A lot of it has to do with just that they don't really know how to start. And much of our practice is a curriculum-based practice, teaching people how their bodies work.
But is it it's not one size fits all? It's not like if I
No.
came in there one day and my
No.
producer came in there, let's say for the same reason,
Yeah,
the plan that you give me would be different than the plan that you would give
absolutely.
the producer
Oh, yeah.
here.
Absolutely.
Folks, we're going to pick this conversation up when we get together at this same time next week. Folks, if you'd like to reach Dr. Guglin, it's pretty easy to do. There's a few different ways that you can accomplish this as well. The first thing I like to tell people to do is head on over to their website. It's very easy. It's hyperfitmd.com. Once again, hyperfitmd.com. But I'm going to give you a forewarning. Keep a pad and a pen near you as you're on their site and as you navigate your way around, because it's going to spark some questions, ones that you may already have, and it's going to spark some others. The second thing is to contact them. There's a couple of ways to do that. You can, of course, email them directly from the website, but you can also give them a call, which is my favorite way. Area code 203-890-9777. The phone number is very easy. 203-890-9777. All right. And if you've got a question, by the way, that you would like to have asked on these very airwaves, maybe even as soon as next week, you know what? Shoot us an email. hyperfitradio@gmail.com. Once again, hyperfitradio@gmail.com. For Dr. Charles Guglin, Francesca Guglin, I'm Gary Byron. Until next week, thanks for joining us. Have a good one, everybody.